go here.
This is Karen with newclevelandradio.net, and it is time for Art Mojo with Melinda Smith.
Hey,
And
Karen.
Linda, you are having a guest return today. Tell us a little bit about that.
Well, for those of you who don't know her, but may have seen, and those of you who may have seen her in the previous podcast, this is Gloria Treister. She's the founder of Wellness Evolution in Cleveland, and she's the author of Wellness 101, Simple Steps to Good Health, which we talked about the other day, or the last time she was on. I lost you there. Were you running
Yeah,
away?
I'm here. I closed the door.
Okay, so you've been on the show before. So for people who maybe have gone out and bought your book, I hope they did, the Wellness 101. We're going to talk about something different today, more direct. So I want to read a little paragraph that says, today we're diving into functional medicine. So you're going to tell us about that. A rapidly growing approach that's transformation in how we think about health and disease management. Whether you're looking to add it to your complement to your conventional care or adopt it as a new primary treatment approach for yourself, functional medicine provides a deeper, more personalized way of looking at your health. So I'm going to turn the floor over to you and say, what is functional medicine?
Yeah. Hi, Melinda. I'm so happy to be back. Thank you for having me. I think functional medicine is the one thing that makes sense to me when it comes to healthcare. It's more of a personalized approach. So rather than our usual conventional one-size-fits-all type of medicine, like you have high blood pressure, here's your choice of medications. Functional medicine looks at you as a system. We'll go into that a little bit more, but also as an individual. There's nobody else like you. And so why get treated like everybody else? If you have high cholesterol, why do you have it? And functional medicine would say, is it genetics? Is it your environment? Is it your lifestyle? Is it your diet? Whereas if you have high cholesterol and you see a conventional doctor, the tools that they have to use to treat you are just selecting which medication is the right med for you. So it's a completely different approach. And the way I like to explain it is that conventional medicine is kind of a top-down approach. So you have a symptom, you go up here, you squash the symptom with a medication. Functional medicine is a bottom-up approach. You have a problem, they're like, hey, why do you have this problem? What's the underlying cause? And they work from the root cause up. So it's, it's a different perspective. And I think it's one that's worth taking a look at for your listeners, at least the approach, because for instance, once again, if you have a conventional medicine approach and you have a stomach issue, they're going to look at you through the lens of stomach problems. But in a functional medicine approach, they look at you more as a system. Everything works in concert with each other. So just because you have a gut issue doesn't mean that it's emanating from the gut. And that's where it's very, very different. They're going to investigate what is the root cause of this problem, where is it coming from, and what's the least invasive way to approach it. They're going to start with the least invasive approach first.
I just read something recently about people who have Alzheimer's or Parkinson's, that it may be gut related. So they need to work with the gut, where it's totally opposite of how they're treating you in conventional medicine with a pill that's helping your brain and the side effects.
Definitely. And there's so many other things that could be, influencing you having that condition. And so, they can work with elimination too. They can say, okay, let's do testing. Now, one thing with functional medicine is that it's hard to access right now. There are not that many doctors doing it, and it can be expensive because they may be doing a lot of different lab tests. The labs can be used to identify problems or to rule out problems. And sometimes those aren't covered by insurance. So one of the things that I'm working on with a functional medicine doctor is we're creating online courses that are specific to different healthcare problems to teach our listeners how to figure out what the root cause is of that particular problem, what to ask your doctor for. In some cases, your doctor might not order a particular test, but if you know that maybe that test could figure something out for you, you might ask them to do it. And if your doctor, who's conventional, requests that test, the chances are that it will get covered by insurance. So a lot of doctors will work with that and be a little flexible and order the test that you need. So that's another point of differentiation.
So if you're looking at how functional medicine differs with conventional, I think I'm hearing, and I think maybe the way I look at it is a conventional doctor is looking at you and saying, you have cancer, here's what we do, A, B, C. Depending on the type of cancer you have, depends on the type of drugs you use. Where somebody who's functional medicine is going to look at the whole picture and not just shoot with the chemotherapy or X-ray or whatever they're doing before they go into any treatment. Is that correct?
That is correct to a point. And one of the things also that a functional medicine doctor would do is look at what your treatment is for cancer, for instance, from a conventional perspective, and then look at what can we also give you adjunctively, like some kind of nutrition or a special diet that can also help support your body while it's going through the trauma of that kind of treatment. Because as you know, I don't have to tell you, Melinda, that treatment can be devastating for some people. And so knowing what to do to boost up your immune system, to help your body deal with all the drugs that are being put in your body to kill the cancer, how to support your cells in a better way, they would know how to do that for you, probably through some kind of supplementation or IV nutritional therapies. But there are definitely ways to do that to support you along that route.
I
I think
go ahead.
Go ahead. Oh, I was going to tell you, I think I mentioned this when I was on before, but to give you an example of how functional medicine differs from conventional medicine, I can share a personal story of where I was losing bone density, and I was very upset about it. And I went and mentioned it to my conventional doctor at my visit last year, my, yearly physical. And she's like, oh, don't worry about it. You don't have osteoporosis. Next year, when you come, we'll put you on a medication for your bone loss. And I said, but I already am starting to lose bone. I don't want to wait a year, and I don't understand what's happening to me. I do weight-bearing exercise. I eat a healthy diet. I take supplements. I should not be losing bone. What's going on? And her response was, don't worry about it. You don't have osteoporosis yet. It's okay. So I went to my functional medicine doctor and said, I'm concerned I'm losing bone loss. I'm losing bone. And she said, well, let's find out why. And she ran some tests that my conventional doctor did not run. She ran a parathyroid hormone test and a blood calcium level test. And lo and behold, my parathyroid hormone was off the chart. If your parathyroid hormone is not functioning properly, it thinks you're not making enough calcium. And so it starts pulling it out of your bones. That was the root cause of my problem. And the answer wasn't to wait a year and put me on a medication. The answer was to get the bad parathyroid gland out of my body. And you have 4 of them. You don't need all of them. I had one bad one. They removed it. And in the operating room, they checked my parathyroid hormone, and it had gone back to normal within 20 minutes of them removing it. So now I'm on the supplements that I need to be on, and I'm continuing to do the weight-bearing exercise, and I'm getting a bone density scan next week, so stay tuned. We'll see if it's working.
It might be another follow-up show.
I know, but that's the difference. I mean, the one doctor was, don't worry, you don't have osteoporosis. It's not that bad. We'll deal with it next year. And the other one, honest to God, she looked at me, she leaned across the desk like this, pointed to my test results, and she's like, you have to take care of this right now. She said, I'm not even going to talk to you about anything else. Go take care of this. So I did.
Yeah, that's important. What I was going to say before was when I was going through cancer treatments, I listened to my body. I wasn't going to a functional medicine physician. However, I did have some basic understanding. One thing is listening to your body. That's very important. So as I went through the chemotherapy, I didn't force myself to eat things that my body didn't want. So if it tasted good, if it worked for me, I ate it. Therefore, I didn't deal with a lot of nausea. I didn't have those side effects that a lot of people had. If I needed to rest, I rest. If I did some exercise, I did exercise. And I really truly feel that by listening to my body, I came through it much easier than other people might have because they fight it. They want everything to be like it used to be. If I wanted mashed potatoes, I ate mashed potatoes and only mashed potatoes. And I didn't get sick. So I think part of it is learning to listen to your body as well.
That's good advice for people all the time. Listening to your body. I think sometimes we're so busy. We know we're stressed. We know we're tired. We know that there's other issues and we don't listen. We ignore it. And that's really good advice, is to listen to your body. Absolutely.
Then you won't get sicker, hopefully. So are there core principles to functional medicine?
Yeah, it's very personalized, which is nice. And that's why another reason that it can be expensive is that it takes a long time to listen to a person's story, which is why with the conventional medical, the provision of conventional medical services right now, doctors don't have enough time to hear your story. You say, I can't sleep, for instance. The first instinct on their part is write your prescription for a sleeping pill, because they only have 15 minutes, and within that time frame they also have to write the notes. They got to order any tests that they want to order for you. They're really pressed for time. If you said to a functional medicine doctor, doc, I can't sleep, there would be a whole conversation that would happen, because they would want to know, well, when did that start? Were you able to sleep well when you were a child? What's keeping you up? What's your bedtime routine? When do you eat your dinner? They want to know, what are you eating for dinner? Are watching television before you go to bed? They want to know the whole story, because it's more about you than the problem. The problem isn't you can't sleep. The problem is you can't sleep. So what is happening for you, not just the general you, but the personalized you? It's one size fits one medicine, because we are all biochemically unique. And there's a whole field of science built around that concept, and it's called epigenetics. And it's over and above your genetics. It's your lifestyle. How do you live your life? What are your genetics? That is important, but also, what are you eating? How are you sleeping? What's your stress like? What's your family like? What are your finances like? Because all of those things impact your health.
Sure.
So it's very important. And like I said, it's very patient-centric. It's all about you. It's about also the root cause resolution. So those are the core principles right there.
It's like putting a puzzle together. Back in the
Very
day,
much so.
the very first time I met you, when I did medical skin treatment in Cleveland, I asked a million questions of all my patients, because what's going on in their skin every day could be related to the laundry detergent they're using, could be their hair products. You didn't know. So you have to be a little bit of a detective. So it sounds like functional medicine creates a detective to find out what you exactly need for you.
Yeah, sometimes we call it being a medical detective. And you're right. And I'm not suggesting that there's anything bad about conventional medicine. Thank God we have,
We have it.
Cleveland Clinic if you have a heart problem or something like that. But functional medicine can work alongside of
It's an adjunct to,
functional. It can. And so, like we used the example before, you're going through cancer treatment. Well, chemo can be very devastating to the body. So a functional medicine doctor could work alongside of that with how to prop up your nutrition to maybe figure out how to combat some of the fatigue or the nausea, things like that. Or if you're taking something for an autoimmune disease, they can help you optimize your gut health. They can help you minimize inflammation in the body. They can help you detox from some of these things, maybe after the therapies. So There's lots of ways that they can work in conjunction with one another. I think the trick is finding a conventional doctor who will understand your desire to do that and not to be negative about it. Because some doctors will say, oh, you're taking supplements. Well, there's no proof behind that. Well, that isn't true. There's hundreds of thousands of studies. They just haven't read them and they're not open to that concept. But some doctors will actually poo-poo it and just say, no, that doesn't work.
Right.
But then again, think about how many medications, pharmaceutical drugs have been on the market and taken off the market because they caused a lot of harm. So the same could be true for just about anything. I think the key is figuring out what works for you. If it works for you, great. And, look, the first concept about medical in the first place is first do no harm. Just figure out if it's not harming you and it's doing you some good and you know how you feel. And like you said, to trust your instincts when it comes to your own health.
It's funny, but when I think I was diagnosed in 2015. And I think they had the department before, but the Cleveland Clinic has a functional medicine department that they refer people to for things that medicate. Either they can't give you more medication, so they want you to try a different route. So I do think the conventional hospitals and conventional medicine has a belief now in that extra piece that functional medicine can do. They don't recommend it as a primary treatment, but it could be a primary treatment, right?
100% it could. Yeah. And I use it for bioidentical hormone replacement because most doctors don't know how to prescribe that. And that's something that they're very good at. The other thing is that functional medicine focuses on certain aspects of your health. Like, for instance, gut health. We know that your gut's your second brain. So when you're dealing with, memory issues or depression or things like that, they'll also they won't just look at giving you an antidepressant. They're going to look at what are you eating and what's your gut health look like. They'll look at what your hormone balance is like. And, that plays a big, strong impact, especially on us middle-aged people. Things like your hormones can affect your energy levels, your mood, your metabolism. How many women that are middle-aged all of a sudden gain weight? That's hormonal imbalances. And those things can be dealt with bioidentical hormones, as opposed to giving people the pharmaceutical hormones, which a lot of them are made out of horse urine. So
really,
that's not, it's gonna, yeah.
I
And
didn't
why
know
would
that.
why would you take the hormones from a over 2,000-pound animal and try to give it to a 150-pound woman? It just doesn't make sense. So another area of concentration for functional medicine is detoxification, because our bodies just were not designed to handle the load of toxins that we take in every day. And so your liver, your kidneys, and Melinda, this, your skin, there's so many ways that we can detox for better health. And that's something that functional medicine will address that your conventional doctors really aren't trained in. So
I think we're seeing this more and more, right? They're talking about the little particles of plastics that they're finding in your body. These are things that didn't exist 40, 50 years ago. We didn't have these problems. So someone like me who is really a healthy individual, and I was a fitness coach when I got breast cancer, and they're like, somebody like you got cancer? Is it running your family? No. I have no idea. I don't know whether I was exposed to something, because we basically grew up at a time when they were starting to bring in all the chemical products like Kool-Aid, the color, the dyes, and things that we ate, processed foods that my mother did not grow up on. She didn't grow up on that kind of food.
Yeah.
But I did. Processed food was what you ate every day. Ho-hos, ding-dongs, right? All the foods that sound really good. And Twinkies last forever. So what kind of stuff is in there that if you eat that, it goes in your body? I think we're dealing with I think functional medicine is important because it's going to take a look at those extra things that really conventional medicine, they don't have time. I mean, you mentioned something about 15 minutes. That's all they get per patient.
It's all they get. And actually, I write a weekly article. I email it out on Sunday nights if any of your listeners would like to get it. I try to make things easy for people to understand. My article this week was on should I ditch the American diet, the SAD diet, standard American diet, which is processed food, sugar, unhealthy fats, all kinds of things that are making us sick. And so if they want to know how to switch that up and get into a different method of eating, I'd suggest getting that article. Each week I deal with something else. Actually, next week, I've decided to do something completely different and talk about empathy and compassion as being part of being well. And I really, really believe that we need that now more than ever. And so I thought, well, this is what I'm going to talk about. But if any of your listeners want to subscribe to my newsletter, they can email me at gloria@wellnessevolution.com. And I'd be happy to send it. I post it on LinkedIn every Monday. And I have almost 1,100 subscribers on LinkedIn, and about 2,000 people get it in their emails. And
I get it.
Enjoy it. Yeah. Are you reading it?
When I can. I will admit I don't always do that.
Yeah.
But I know
Well,
I get it.
It's about diet. And the other thing that we should talk about too, that's one of the basic premises for functional medicine is inflammation. Because
I
as
was going to
we've
bring that up.
talked, inflammation is the root cause of almost all disease. And all those processed foods and the sugar, they all create inflammation in the body. And so anytime you have a medical problem that ends in itis, ITIS, that's inflammation, arthritis, gastritis, anything that ends in itis. That was another one of my articles a couple weeks ago. It's like, what's your itis? And really learning how, and it's not hard. I want your listeners to understand that being well is not hard. Don't make it harder than it has to be. It's really not hard. You can eat foods that are anti-inflammatory, or you can eat foods that are pro-inflammatory. Some foods cause inflammation. Some foods tamp it down. I have a list in my book. It's just one page. On one side, it's got the foods that cause inflammation. On the other side, it's got the foods that cause inflammation to go away. If you start just there with that one simple step, you can eliminate a lot of health problems. And, you know, some people my age now are getting knee replacements, shoulder replacements. They all have pain. All that's coming from inflammation. We don't have to have that. We can take care of ourselves so that we don't.
Unless somebody's actually damaged their knee or their shoulder in the muscle. I don't know, about probably 12 years ago, went on the 7 high allergy diets. I took out all of the high allergy foods. And I will tell you the difference in my hands, you mentioned about arthritis, it was amazing. And when I gradually added things back in, I started getting pain back in certain areas. So I know what those items are that cause that kind of pain for me, the inflammation. Now,
that's such a good takeaway, right? It's such a
right.
good takeaway. Really, the most highly inflammatory things are dairy and gluten.
And gluten, and those were when I finally, ice cream, I have to admit, ice cream is my favorite dessert. So I'm never going to stay away from that all the time. I'd rather suffer the consequence on an occasion. However, when I went back to my favorite place and got my favorite ice cream, I thought I was going to die that day. I mean, my gut, oh my God, I was bent over. I'm like, no, I can't. This is my favorite ice cream. And if you go back and you take it a few times in a row, guess what? That feeling goes away. But that doesn't mean it's good for me. What my body was telling me is, this is probably something you should limit.
Well, if you think about what dairy is, I mean, cows have what, 8 stomachs or something like that? I mean, we have one. We weren't designed to eat the breast milk of cows. So it makes it hard. There's certainly some things that are very good that are dairy. There's good dairy Non-dairy options, though. You might even find an ice cream you like that's non-dairy. They make one out of avocado that's really good.
I've had avocado products. You're right, it is good.
Yeah.
But there's still some, if this has been your favorite thing for, 20 years,
Yeah.
it's hard to give that up. It really is. And so maybe that's something the listeners want to hear too is, okay, we find out maybe this bothers us. Can we come to an middle ground on some of these things and still have them on occasion and not destroy all the time you put in to get healthy?
Yeah, and the best way to find out if there's a food that's bothering you is to completely eliminate it for 3 weeks, for 21 days.
That's what I did
It takes
for
that
months.
long to get it out of your system. And then once it's completely gone, then you can add it back slowly. And if it starts bothering you, then you know that you have a sensitivity to that food. And then you can make your choices. I mean, it's all about choices, right?
Mhm.
If you want to eat ice cream and have a little tummy ache, that's okay. It won't kill you.
Yeah, as long as you're
Right?
not doing it every day. I actually started the diet because my son had horrible stomach issues from the time he was born. And he was at the Cleveland Clinic and they were at a loss. I mean, they did everything they could think of doing, medication he was on. So finally did some reading and I said, this is what we're gonna do. We're gonna take all these out. And if you're doing it, I'm doing it. Because if I'm cooking, then I could share that with him too, right? And myself. And he would follow if I did it, and he did. And he was so much better after a year. And she goes, what did you do? I said, I just took out high allergy foods and then didn't and added one thing in at a time. And what he could tolerate, he went back to. Now, when he became a teenager, did he listen to me? No. And
Right.
he's gone back to having GI issues. So at some point, he may have to do that for himself again because no medication works. None.
Right. And if the listeners have a problem, a health problem, and they're thinking, could it be diet related? My best suggestion would be to keep a food diary
Mhm.
and make notes of how you feel after you eat certain things. And keep in mind that food sensitivities don't always show up right away. A food allergy will. If you eat something that you're allergic to, you could have anaphylaxis and die. You get a very severe reaction from an
Mhm.
allergy. But a sensitivity might not show up and, it might show up 3 days later as a headache. And it's really hard to connect the dots. So keeping a food diary is very good and it's empowering. I think the message is to listen to your body, like you said, Melinda, but it's empowering to know what to eat, what not to eat, and what you can do about it when you have issues and what to look for and how certain things impact you. Toxic chemicals, look around your house. Are there things that are toxic? Learn to read labels. All of it is meant to be empowering, and that is a basic tenet for functional medicine, is that who's in charge? You are.
Of
The
your
doctor
body.
doesn't go home with you. When you leave the doctor's office, whatever they told you, they're on to the next person,
Mhm.
and you've got to deal with that. So don't just take everything they say for the gospel. If something doesn't feel right or sound right or it isn't working for you, go do your research. My goodness, with AI, you can you can find out a lot of stuff. Now, is it all true and is it all going to relate to you? Maybe, maybe not. But the
Mhm.
more you know, the better questions you can ask and the more you can find out and really dig into what you're wanting to learn.
Well,
There's no reason to suffer.
part of the problem is conventional medicine doesn't have the time to learn those things. So it's
Mhm.
easier to say, no, let me give you this drug because they know about the drug because the drug rep came in and explained it all to them. And
Right.
they don't look for the interactions either. I'm a big one with that. Like if I'm going to take this, then do I take this other drug? Will the two interact? Now, pharmacies look for that, but I'm not even talking about at that level, just how it reacts in your body,
Well,
what to
part of my article this week, one of the things that I wrote about was supplements because people take supplements very indiscriminately, like they're no big deal. But taking a supplement at the right time of day is very important. Some are meant to be taken early in the day, some are meant to be taken late in the day. Some are meant to be taken with food. Some are meant to be taken without food. Some interact with medications and some don't. So I'd like for people to be a little bit more curious about something when they're taking it. Just because it's on the shelf at Costco or wherever you're getting them or on Amazon doesn't mean that you can just take them and there's no big deal about it. First of all, you might not be getting any benefit from it if you're not
So
taking
you're
it
wasting your
properly.
money.
I mean, some things have to be taken with food because they're fat soluble, and that's the only way your body can actually absorb them. So once again, I'm not trying to make it complicated, but I'm suggesting that you go one layer deeper, like go a little deeper, make sure what you're doing makes sense and that you know how to use it properly.
It's the same idea with regular medications. I mean, you're supposed to take them with food or not with food. So you have to look at it in that same light.
Yeah.
You're using it to treat your body like you would a conventional medication. You need to follow the same rules of the game.
Yeah.
And do some
Right.
research.
And keep in mind too that fully 80% of all chronic disease is manageable through lifestyle. You have more power than you think sometimes over your body. Some people say, well, my mother had arthritis and my cousin has arthritis. I have arthritis. There's nothing I can do about it. That's not true. And don't tell yourself that. Be more in charge because it's your life. If you want to spend your life in pain, if you want to spend your life complaining about this ache and that pain, that's fine. That's your business. It's not how I choose to live mine. And the other thing that I'm very, very passionate about lately is encouraging people to sit down and think about, why do you want to be well? What's your why? For me, my why is I want to play with my grandkids. I love them. They're young. They want to get on the floor and play. We're going to play. I don't want to say to them, I can't do that because I can't bend down. My knee hurts. I'm not going to do that. That's not who I am. So when I make choices, and someone said you make like 30,000 choices a day. It's some crazy big number. When you make choices about things that affect your health, think about your why. I'm not going to eat that second dessert because I know it's going to inflame my knees and I want to be able to bend down and get on the floor and play with my grandbaby. So, if you kind of attach your why to what you're doing, sometimes it makes your decisions a little easier.
I think sometimes we also, why it isn't easy is convenience. It's just easier to do it this way. I've always done it this way. I'm supposed to get old. This is a youth-oriented culture, and it is. So I'm supposed to get old. It's just normal. Instead of looking at it from the direction you're looking at it, which is you have some control. We are basically taught we don't. We don't have control. We're going to age. That's what's going to happen. And you just deal with it. Take a pill, deal with it until you can't.
Right. Yeah, it's not for me.
Well, it's not for me either.
There you go.
That's that was the challenge of going. That's how this all came about. This program was getting through challenges, and that is a challenge for people today. If you think about it, we live so much longer because of the medicine that we've had, right? When my grandfather retired in 1972, he was 65 years old. The average lifespan was probably 67 or 68 for him because men retired and they died. And that's what your life was. And so we have a lot of that still here, even though boomers fight it really hard to try to stay youthful. We still have a piece of that. Like, okay, well, I'm retired. I'm supposed to get decrepit. I'm not supposed to be able to ride the bike with the grandchildren or play on the ground. And I think we battle that. We battle a cultural piece to it, as well as, we're staying alive longer. It doesn't mean we're staying healthier alive longer. If that makes sense. That makes sense.
Problem. Yeah, we're not doing that for the most part. And I think that's a missed opportunity for people to really enjoy their life fully. I believe that there's a better way. Look, sometimes you can't help it. Something's going to happen and you can't help it. But the way you react to it, the way that you handle it, the way that you take charge of whatever that issue is, that's your choice. So, you make choices.
Conventional medicine has us believing that when you hit a certain age, these things start to fail.
Mhm.
I have two shoulders that don't work real well. I've been going through physical therapy. I know what foods aggravate it. I know my temperament that aggravates it. My conventional doctor thinks I'm crazy, and I said, that's fine. When I take care of myself through exercise and diet, I have less pain. Do I have no pain? No. I have two injuries. I know that. But
Mhm.
I'm not going to go through the surgery that when they say to me, it's going to take you a year to recover, and we don't guarantee you're going to feel any better. You know what? I'll find a way to feel better. But
Mhm.
Yeah.
conventional medicine wants you to be convinced, here's some pills, here's the surgery, here's what you have to do or suffer. And I don't think we have to suffer. We have to teach people like you are, there are other ways.
Yeah, I think that's so important, and we can live a good life. And yeah, you're managing what you have there, but you could be in total pain and be, oh, pity me, and say I'm just going to eat whatever I want to eat, and but it's cumulative. So the more that you abuse your body, my new way of starting out my Wellness 101 talk is, how many of you have a spare body that you keep at home that you're going to move into when you trash this one?
Give them
And I
some
look at
time.
the room and nobody's raising their hand. And I'm like, nobody, right? Because you don't have one. You
Right.
get one. You get one. So it's your choice. How are you going to take care of it? And look, you don't have to love it because of your grandchildren. You could love it because you're vain and you want to look beautiful, and your skin will be better and your weight will be better. Or you could love it for other reasons. But just find your reason and do it, because that's your best motivation.
So we know, based on the conversation, I think, and anybody listening, that functional medicine benefits you, right? It can benefit you to stay healthier longer. But what do you do with the person who just doesn't have the financial wherewithal? It's back to your seminars or things like that, because functional medicine is not inexpensive. And people have a hard time paying for the drugs that are given to them by their conventional doctor, let alone this. They also have to overcome the family mumbo jumbo. Oh, that's just mumbo jumbo. That doesn't matter. That's not going to help you. So financially,
Yep.
do you have suggestions? And then dealing with their significant other, the rest of their family who says, oh, that's a bunch of bull. That's not going to work.
Yeah, I hear that all the time. I hear that all the time. And that is unfortunate. You just have to be, when it comes to other people criticizing, if you're trying to eat right or whatever, just say, you know what, I'm doing that for myself. And I understand that you don't agree, and that's okay. But I'm going to do this for myself. Just be brave enough to do that. Sooner or later, you're going to be the one that's well, and they're going to say, hey, what are you doing? You're doing so much better than I am. What are you doing? Because it's bound to happen. The other
Mhm.
thing is to learn what you can. You had mentioned my book, and I appreciate that. Wellness 101, Simple Steps to Good Health. And in there, I have made it extremely easy to learn what it takes to be well. It's not that hard, people. It's really not. And you can learn it. You can learn a little something every day, even if you don't have a lot of time. Let's say you should exercise, but you don't have time. Do what I call exercise snacks. Do a 10-minute exercise, something. If you're on the phone with your girlfriend or a business call, walk around the house or the office with the phone in your hand. Just walk. 10 minutes, great. Do what you can. When your coffee's brewing in the morning, do some push-ups against the wall, do some squats,
I
do
do
10,
that every
do
day.
20. It's a good use of your time, and it all adds up. Don't think that you have to put an hour together somewhere in your day to work out. You don't. It all counts. It all matters. And just try to get a handle on your food. I've I don't know if I can say this, but there's
Mm.
pictures in here, how to set up a plate of food. There's so many, it's easy. These are the foods that have fiber in them. Fiber is really important. It's all on one page. So get some good information like that and start just learning. I like to joke about my book, and my husband doesn't like it when I say this, but I say it's a great bathroom book. because you can go in the bathroom and sit down and read 1 or 2 pages and be done with that for now, and you'll learn something. So it's really easy. The other thing is, if you can't access a functional medicine doctor, look for ones that are doing a podcast like this and listen to what they're talking about. Take some notes and get one takeaway. You don't have to remember everything they said. Get one takeaway that you'll do starting that day. Because once you start on this path, you'll start feeling better. You'll start seeing that you look better. And the whole thing will just become easier and easier. And everybody, including myself, falls down every now and then. I mean, over the last month, I hosted 2 parties at my house. Well, we had leftover dessert, we had leftover appetizers and chips and
At the
nuts.
cost of food, you don't want to throw it out, right?
We finally threw out half of a lemon meringue pie because I said, I don't want that looking at me anymore in the refrigerator. What's the difference if I eat it or throw it away? So we threw it away. But, we went on a sugar thing. And once you do that, sugar will get you. It's very addictive. It's
More
also
addictive.
very cancer producing. Cancer loves sugar. If you have cancer, I would say cut sugar out completely. And, once you start eating it, it's so addictive, you can't stop. And so it happened to me, it happens to everyone. But the bottom line is, sooner or later, you just have to say, that's enough. Now I have to take care of myself.
Right. So what kind of takeaways do you think someone should, before we close, what kind of takeaway do you want to throw out there and say, just do this or this?
I would say learn what you can about reading labels. I mean, on your food, I mean, on your personal care products and the cleaning products you use in your house. Those things are hormone disruptors. A lot of those additives are hormone disruptors. What does that mean? It means, number one, it could cause you to gain weight. And so many people struggle with weight. Maybe if you're not able to lose weight, it's because you are too toxic. Toxins hold on to fat and fat holds on to toxins. It's a vicious cycle.
And it goes in the middle.
Right in the middle. Yes, it does. And we just weren't designed to handle as many toxic chemicals. Like you alluded to earlier, Melinda, we're walking around with pieces of plastic in our bloodstreams. I mean, it's in our food, it's in our water, it's everywhere. And plastic, if you look at the graph over time of the history of plastic in the United States, and you look at the rise of the use of plastic, you'll also see a very similar rise in cancer.
Cancer, yeah.
So plastic's a big problem. So learn about toxic chemicals, learn what they are, be a label sleuth, read your labels, see what's in them. Try to eat organic the best that you can. Glyphosate, which is Roundup, is another toxic chemical. There's pesticides, there's weed killers. That's what Roundup is. Those things are in your food if you're not eating organic. Get as much organic as you can. And you can look up, if you can't afford organic or it's not readily available in your area, then eat foods that don't need to be organic, things that have thicker skin on them.
They have a list of dirty foods, right?
They do, the Clean 15 and the Dirty Dozen. And I have that in my book as well. You can go on to EWG.org. It stands for Environmental Working Group.org. They're the ones that do the Clean 15 and the Dirty Dozen every year. They do a different one each year. That will tell you which are the most highly sprayed fruits and vegetables. So you know what you should get organically, like strawberries, for instance, and grapes are very highly sprayed. So those you would definitely
love strawberries.
Yeah. But you know what? The organic ones aren't that much more expensive anymore either. And if you go to like Trader Joe's or some of these stores where they've gotten better at pricing things, you can get good deals on organic. Costco has a lot of organic. And learn how to grow your own food if you can't afford it. I work with a nonprofit here in Cleveland that is teaching kids in school how to grow their own food. We all need to know that. So that's really important. And it also helps them when they grow it themselves. They're more apt to taste it and see if
Right.
they like it and that kind of stuff. So it's a good lesson. And I think the big takeaway for me, and this is my new thing, I heard somebody say this and I thought it was really cool, is to be cool to your future self. Be kind to your future self. Everything you do is cumulative. All of your health and wellness habits are cumulative. So if you say, well, I'm eating McDonald's every day and I feel good, what's the difference? That's building up inside of you. And people don't just have a heart attack, right? Things
Right.
build up. And then one day, all of a sudden, your, artery gets blocked and you can't pump blood to your heart anymore and you fall over. It doesn't just happen. You don't just get back pain. You don't just get knee pain. This is cumulative lifestyle behaviors that
Right.
add up. And so just be cool to your future self. When you're doing something, say, am I being kind to my 70-year-old self or my 60-year-old self?
And if you're already
Or if
60, there's still things you can do to help
or
yourself,
if you're
right?
over 70 like I am, so I'm looking at my 80-year-old self. Am I going to
Right.
be healthy then? And I'm working for that end. I'm going to see what I can do.
Absolutely. Well,
It's
we
a
really
challenge.
appreciate you being back again and talking
Thank
about
you.
this. I really feel it's important for people to know their options. I want those options. I'm sure somebody else is going to watch this and say, yeah, let me check that out. So I do appreciate your time coming back.
Yeah, and please email me if you have a question. I love helping people. I'm available at gloria@wellnessevolution.com. You can hop on my website, check out some things. There's some freebies on there too. I have a 30-day health recharge on there that gives you one little tiny thing to do each day for 30 days to help you get on a wellness habit. So if you're saying, I don't even know where to start, it's too confusing, I don't know what to eat, I don't know how to exercise, that will help you.
Great.
Very good.
Well, thank you again. We look forward to having you back at some point. We'd love to meet your functional medicine doctor that you work
Oh,
with. So maybe we can do that on our next visit.
I think that would be great. And maybe if you can poll your listeners and find out what they want to know from a functional medicine doctor, we'll get Dr. Gutierrez on here and have her talk. She's phenomenal. I think
Great.
you'll love her.
Great.
Great.
Thank you. Thank you
Have a
again.
great day, everybody. Bye-bye now.
Bye-bye.